When it comes to heart disease, I know that it's multifactorial, similar to cancer and a lot of diseases out there. There's a lot of factors at play. But if you were to kind of rank a hierarchy of maybe the top 3 things that contribute to heart disease, and it might change in the future, so I won't hold you to it, but at this point, what would be those top 3 things in order that you believe lead to heart disease?
Yeah, so it turns out that it's really not multifactorial. It really is one factor that it comes down to. Now, there are different things that lead to that factor, but when we're talking about, and just this needs to be made clear, because there are different forms of heart disease, but the most common form is what we call atherosclerotic heart disease, the buildup of plaque within the arteries of the heart that can ultimately lead to things like heart attacks. And when you look at atherosclerotic heart disease, it really comes down to one major factor, and that is damage to the blood vessel wall. That is the inciting event that has to happen for these plaques to start to build up. Now, what causes that damage? That's where we get into some different factors.
That's the question.
Ones,
yeah.
Yep. The big ones are going to be insulin resistance, first, and foremost, probably the most common problem today. Smoking is another big one. Now, we've done a pretty good job at cutting down on the smoking rates. And, that ultimately is what led to some of the improvements we saw around heart disease, throughout the 1980s, 1990s, and, up until about 2000, when that downward trend that we were seeing started to go back up again. Probably high blood pressure is the other most common one we see. But again, high blood pressure acts via insulin resistance. Mm-hmm. So it really comes down to insulin resistance and then other toxins that damage the blood vessels, smoking being the most common, but there are other things like heavy metals, air pollution, things like that can cause that as well. But ultimately, we have to come back to damage to the blood vessel wall, to the lining of the blood vessel, as the root cause of heart disease.
Would you put industrial seed oils in the category of other toxins, or would that be a different category?
Yeah, so vegetable and seed oils are certainly a contributor to heart disease. And I know, again, that's going to be a very controversial statement, because you look at the bottle of the vegetable oil and it has the American Heart Association stamp on it saying it's heart healthy. But yeah, vegetable and seed oils contribute to this. And what's interesting about vegetable and seed oils is they also act through a number of those mechanisms. They are mitochondrial poisons when we really get down to it. They cause insulin resistance. They contribute to insulin resistance. And, the fatty acids that are in those vegetable and seed oils, the omega-6 fatty acids that are in them in amounts that do not occur in nature, which is the problem, are pro-inflammatory. And again, inflammation is one of the things that causes damage to blood vessel walls. So vegetable and seed oils, I do think, are very problematic. And, I acknowledge that it's hard to separate the effects of vegetable and seed oils from sugar and processed carbohydrates, because our modern food environment combines those things. No one really consumes vegetable and seed oils in isolation. It's in all of these processed foods that have all of these other problematic ingredients in them as well.
That's a fair point. Yeah, they usually come combined together. Okay, so you said there are several reasons why there's damage to the blood vessel, but damage to the blood vessel is the only cause of heart disease. But what is leading to that? Many different things. You mentioned insulin resistance, smoking, high blood pressure, which is linked to insulin resistance, other toxins, heavy metals, and of course, vegetable oils, which is something we talk a lot about. If that's the case, and I agree with you, then when the average person goes to their annual checkup with their doctor, there's no fasting insulin on that blood test. There might be a fasting glucose and maybe an A1C, but why isn't there a fasting insulin if that is one of the most important things to pay attention to with the leading killer of disease in America?
Yeah, it's a great question. It's certainly a test that I use with my patients, and I know many other doctors who are, aware of this now use it. I believe the reason that it's not used in mainstream medicine is because we don't have an answer for that problem. So if you get that insulin test and you see the patient has a high insulin level, there isn't a prescription to write to bring it down. And that I think is really, at the root of why we don't look at this blood test. It's also very misunderstood by physicians. It's really just not part of our educational environment. I think back to my medical school days and my training, and there was no mention of insulin levels. Of course, we learned what insulin was, what it does, its role in diabetes. But no one talked about checking fasting insulin levels. And throughout my early career, again, I never saw a fasting insulin blood test done. And it was only, as I said, when I started getting into this other information, and I learned the importance of that test. And I learned how we deal, how to manage that problem of hyperinsulinemia, that, I started checking it. But we can go back to, again, much of this work was done in the 1960s, 1970s. Joseph Kraft and Gerald Reaven, two instrumental physicians and scientists who demonstrated this specifically when it came to heart disease. Gerald Reaven's work shows us that over 90% of the patients who present with heart disease, heart attack, or some other presentation of heart disease are insulin resistant if you test for it in the right way. And that's the key, but even the mainstream statistics point us this way, because we know that about 60% of the patients who, either have a heart attack, need a stent, or end up needing bypass surgery are overtly diabetic or pre-diabetic. And, those are just the late stages of the insulin resistance continuum. So no matter how you want to look at it, it's obvious that that's the problem. And unfortunately, mainstream medicine has kind of ignored that because they don't have the solution.
Yeah. Not yet. When they get meds for it, they might start testing for it. So if go get your fasting insulin done, that's the point. Let's look at where that's at, because your glucose and your A1C might not change that much for several years. Meanwhile, you are developing, or you might have insulin resistance, and your body, your pancreas is working so hard to keep those glucose levels in check until it doesn't. And then that's when you're diagnosed. But we want to be proactive, not reactive.